So the project that I worked on with Ways to Wellness, it was initially just a 6-month project. So we got funding for 6 months, and it was specifically for people who were taking strong painkillers. Because we know people who take a lot of painkillers before their surgery are always going to struggle after surgery, and they don't just struggle with increased pain. There's lots of other side effects that you can get from taking a lot of painkillers before surgery, and it's not the people's fault that they've needed these painkillers beforehand. But if we can help make things better for them before surgery, it might be that they might not need as many painkillers, so they would have better surgical outcomes. So what we did was we worked with 10 GP practices around Newcastle, and they identified 20 patients each that they had on the waiting list for surgery who they thought would benefit from this project. And then the GPs and myself and Ways to Wellness, the social prescribers who worked at Ways to Wellness, worked together to try and help these people to put them in the best place before their surgery. So I think that one of the major things about this project was that people had time to sit with these patients. And if a patient has chronic pain, they often feel like they're being a burden to everybody. They think nobody's listening to me, nobody cares, nobody really believes that I'm in pain. And I think the fact that we could fund this project and give people the time, these healthcare professionals and the social prescribers, time to sit with these people and actually listen to them, the patients really felt almost like validated and accepted, and they felt like that the healthcare professionals understood them better. And I think that was probably one of the most important things. I mean, the project was funded. The aim was to reduce people's painkillers, but we sort of changed it slightly and said, no, we want to make people feel better. If they feel better, then they might be able to reduce their painkillers. And we actually found that we were really successful in reducing people's painkillers because people felt better, because they weren't being pressurized to reduce painkillers. The focus was on them and making them feel better. Oh, the social prescribers were amazing people, because I think healthcare professionals, we're very focused on, we have to do this and we know what's best and we will get this person ready for surgery and this is what they need to do. And actually, I think we're not very good at, we try, but we're not very good at looking at the whole picture. And sometimes the patients that we see, they're nervous when they see us and they're anxious, and they don't tell us everything because they think it's not relevant, it's not important, these people are busy, they don't want to ask us questions. And having the Ways to Wellness social prescribers working with those people so closely, it meant that people could ask those questions, that they could talk about things that they were worried about, that they felt we didn't have time for. And we probably would have had time if they'd asked us, but they didn't feel that they could. And by us working so closely as a team, we had the primary care GPs, the voluntary sector through Ways to Wellness, and myself through secondary care. It meant that we were all working together instead of separately. And I think we're not very good in the NHS at joining things together sometimes. So the social prescribers really helped us join everything together. So I'd done some work with the Waiting Well team, and I knew from that, I'd heard a little bit about social prescribing, but prior to that, I knew nothing about social prescribing at all. I'd never even heard the term. And actually, when I've talked to other people in secondary care about social prescribing, a lot of them are really unaware of it. And I think we need to know about it, because we need to be using that resource. Because when I talk to people in secondary care about social prescribing, they all say, well, that's amazing, that's wonderful. Why aren't we seeing more of this? It was really interesting to find out the sort of things that they can do, because we have lots of people in the hospital who can help people. We've got the occupational therapists, the physiotherapists, we've got the social workers, but actually they're dealing with lots of different people, doing lots of different things, and they're just concentrating on one bit. The social prescribers are really looking at the person's whole life and supporting them in lots of different areas, not just one. So obviously some people had been taking painkillers for an awful long time. Some of them had been on painkillers for 20 years before this project. So you can't expect them to go from taking painkillers for 20 years to not taking any painkillers in a 6-month period. If you're cutting down somebody's painkillers, it has to be a very slow process because it can be quite difficult and quite frightening for them. So we didn't expect to get everybody off their painkillers in the 6 months. But actually within 6 months, 30% of the people that we'd recruited had stopped taking painkillers completely. And overall, we'd had about a 60% reduction in painkillers. And that's not just about saving money. Everybody thinks it's about saving money. It's not. We know that if people take painkillers long term, they get a lot of side effects from the painkillers. They're not getting a lot of benefit from the painkillers. And the problem is, if people get side effects from the painkillers, they don't often think that's what it is. They think the side effects are from pain. So they'll talk about, I can't sleep, I've got no appetite, I've got no interest in the world, everything seems grey. And they think that's the pain that's doing it. But it's not, it's the painkillers. And by reducing the painkillers down, people sleep better, they can eat better, they say things like, I'm no longer walking around in a haze. I'm more interested in my family. I've got my life back. And that was what we were very focused on. So this project was, I find it hard to put into words, but it was one of the most enjoyable things I've ever done in my career as a nurse, because everything was so positive about it. Normally when I do a project, there's bits of it that I enjoy, there's bits that are hard work, bits that are really difficult, but everything just seemed to fall into place and everybody was enthusiastic, working together. And when you get that enthusiasm, it's a really positive thing. So every time, not just myself, I could tell with other people as well, we'd have a meeting and we'd all end the meeting on a really positive note. And that, because we were feeling so positive about it, it meant everybody maintained their enthusiasm for it. And I think that's one of the reasons that we got such good results, that, you know, it was just an amazing experience. It was really, really good. And I met some really nice people. And actually, because of this, it's meant that I've got better relationships with primary care and with the social prescribers. I've been able to develop that more. And I think that's really important. So we're all working together more.